welcome to the University of Maryland School of Public Health's Accepted Applicants virtual event. Congratulations on being admitted to the fall 2020 class in one of our many graduate programs. My name is Steve Roth. I'm Associate Dean for Academic Affairs in the school. It's my pleasure to be with you today, and thanks for joining. We have a big agenda today, and I want to provide a quick overview of the team who assembled this, and my thanks to Britt Saxvig, our Director of Graduate Student Services, and Alana Duarte, our Recruitment and Admissions Coordinator, for working with the group today. With that, I would like to introduce our Dean of the University of Maryland School of Public Health, Dr. Boris Lushniak.
Thank you so much, Steve, and thank you to everybody who's out there in these very interesting times. So what a time to be considering going back to an educational academic center in public health, or to continuing your education in either our master's or doctoral level academic work. So first and foremost, so forgive us for not doing this all in person. I have a great time every year. We have the admitted students session at College Park. It gives us an ability to meet you one-on-one, for you to see sort of the environment of our academic center. And at the same time, I like to walk the room when I give sort of this greeting from the dean and from the dean's office to potential students. So today, bear with me as I have to sit here. It's been an interesting few weeks, I'm sure, for all of us. But once again, I can't emphasize enough the fact that you are thinking about expanding your educational opportunities in the realm of public health is a critical feature of what we're now talking about and how we're reacting and interacting in the midst of a public health crisis. So let me tell you a little bit about myself, and then I'll tell you a little bit about my perspective of the school. So I've been dean here at the School of Public Health, University of Maryland, College Park, for the last 3.5 years. Prior to that, I spent 28 years in the federal government. And so it's very interesting to be now viewing yet another public health crisis from a slightly different angle, and that from an academic center. 27 of those 28 years, I was wearing a uniform. It was the uniform of the United States Public Health Service Commission Corps. This is one of the 7 uniformed services that's mission is to protect, promote, and advance the health and safety of our nation. Started out with 16 years at the CDC, 6 years at the Food and Drug Administration, and then 5 years at the Office of the U.S. Surgeon General, where I was honored to serve for 5 years as the Deputy U.S. Surgeon General and for 1.5 years as the Acting U.S. Surgeon General. And during that time span, I've seen public health from various different angles. And we always do our work day to day. That's the part of public health that you have to realize is important. It's not just in the time of crisis that public health shines. Public health shines in the time of crisis because all of a sudden people are paying attention to what we're doing. They're relying on us, much like we're standing side by side with our medical colleagues. Yes, they're on the front lines taking care of patients, but the public health people are in the action right now. They are doing things that are important to both solve this problem of COVID-19, but also to be able to plan for the next issue that comes up in the public health crisis world. What I want to emphasize is that our work continues outside of these crises, and then continues in the realm of disease prevention, health, wellness. It's the idea of how do we look at health in our society. And I always mention that, I really am a follower of the World Health Organization definition of health. Health is complete. Not just partial, it's not like we're almost there, it's complete. So therefore it has an aspirational component, but it's complete, physical, mental, and social well-being, and not merely the absence of disease or infirmity. So if you look at public health, I always talk about the 3 Ps of public health. It's promoting health and wellness. It's preventing disease and injury with the ideal of prolonging a high quality of life. So you put all that together is that we actually do our work each and every day. We talk about diabetes prevention. We talk about nutritional issues. We talk about overweight and obesity. We talk about cancer prevention. We talk about the social inequities in life, health disparities. All that falls in the realm of public health. And so public health shines each and every day. We realize that it shines each and every day. We have to remind the public that it's not just in the time of crisis that it shines. And yet, what I can see from my own career path is we obviously do step up to a whole nother realm in the midst of crisis. And I look back at my own career and kind of look at what I have been involved with as a commission officer in the Public Health Service. And it really starts at the beginning of this century. Right? It was the World Trade Center. And so I was a responder there. It was the anthrax attacks. I was stationed in Washington, D.C. there. It was Hurricane Katrina. It was the 2009 H1N1 pandemic. It was the Ebola epidemic. All those things, I was honored and humbled to be a responder. And now that we're in the midst of this crisis, I still view myself as a responder. Yes, no longer part of the federal response. But what are we doing at the School of Public Health in the midst of all this? Right. First of all, it all started with us taking care of our own community. So it's still a community. College Park is a community. It's a community of 30,000 undergraduates and 10,000 graduate students. It's a community of faculty and staff. And so when this brand new virus appeared, it was first noted by WHO, right? The Chinese reported WHO as an outbreak of 24 cases of pneumonia on December 31st, 2019. Unknown etiology. Within a week, a brand new coronavirus had been discovered. And we as a community interacted and reacted right off the bat. We began, first of all, concerned about our students who were studying abroad. What do we do? These are public health decisions, right? What do we do? Do we bring them home? How do we do this? Right? We look at not just our students in China, but in other parts of the world. That then evolves further as the disease spreads to us looking at the rest of our community. Well, what do we do about our students on campus? How do we prepare for this? And what you see is some of the result of that is we've gone to a teleeducation model. And, we're not necessarily happy about this. I'm an in-person sort of person, but it's necessary in the midst of this crisis. So the whole idea of public health is adaptation. It's resiliency. It's the ability for us to look at a problem and try to solve it. Ultimately, we led ourselves down a pathway that now includes what? A very different academic year. The key feature here, however, is what? Key feature is the academic year continues. The online formatting that had to be designed in a matter of weeks, the ability for us to make sure that our students had this connectivity, the idea that our faculty were ready for this as well. These are all cultural shifts and necessary shifts in the midst of a pandemic like this. So when I talk about my career path, I look at it as an evolution. Right? I've gone from being a public health practitioner to now being a dean of a school of public health. And what's unique about our school of public health? Well, first of all, we're a young school of public health. I don't have the history of the years of many other schools that are out there. But youthness, right? Youth and the agility of only being 13 years old as a school of public health allows us to, in essence, be risk takers. We have not years and years of tradition built into our system. We have the ability to change, to be able to form a 21st century school of public health. We have a young and vibrant faculty, people who are eager to teach, people who are eager to be mentors, people who are eager to be the researchers, co-researchers with you as students. We also have a very unique environment. Now, a lot of schools of public health are based with schools of medicine, for example. And I'm a physician by training, that's my background. But I look at this that we have a partnership with the School of Medicine, but it happens to be 30 miles away. That actually is great for me because I'm looking at 21st century style partnerships in public health. The medical people, the nursing school, the dental school, the social work school are all critical to me. But in the 21st century, I'm looking at partnerships with the School of Engineering, which happens to be down the block. I'm looking with partnerships with architecture and planning, those planning and building the buildings and the communities of the future. Right? They have a public health mission. I'm talking about partnership with the School of Public Policy as we look at their expertise, the School of Education. Right? The beauty of being a college park And in essence, in that community is that the partnerships that are available to you as potential students are immense. So what do we offer? We offer, in essence, a young, vibrant school of public health, ready to go, one that could be agile and change rather quickly to the times that surround us, as evidenced in these last few weeks, us responding to this call to action in the midst of a pandemic. It's a school of activists, right? Right off the bat, we also started working closely with our local health departments, turning to our own community, Prince George's County, faculty, staff, and students, saying, how can we help? And in essence, various projects starting off from that point, assisting those responders who are working still at the government level. We're also working with the state of Maryland. The beauty of our location is that we have an incredible state that needs a school of public health, that wants a school of public health. We also have the capital region. We're 9 miles, as the crow flies, from our School of Public Health to the dome of the Capitol. So everything Washington, D.C. has to offer is right there, right near us. And the power center of, one would say, the US government, one would say also the power center of public health in the United States. So I enthusiastically ask you to look at us, right? To look at us seriously, to look at us as a school of public health that stands uniquely. Different than other schools of public health, we're a state-based school, we're a university supported by the state of Maryland. We're a land grant institution, and the essence of the history of land grant was to make people, to create, to take in those students, to be able to give back to society. We have initiatives that are very unique in health literacy, in environmental health, and health equity. We're expanding our global health reach. And how do I define global health? Global health begins the minute you open up the door of our school onto the street in front. That's the globe. And we're also, again, a group of individuals that want to do good. We're a do-good university on the do-good campus. So thank you so much for being part of this event this morning, this kind of unique setting. I'm sitting at home. I have my Maryland paraphernalia behind me. I am not a natural Terp. I am now genetically changed to be a Terp in the last 3 years. It's a campus that provides many different activities at many different levels, and we would love you to be part of our family. So thank you so much for being here, and back to you, Steve.
Thank you so much, Boris. Great to have you this morning. All right, folks, we are going to continue on with the session. So while we can't invite you to campus today, we at least want to provide a little bit of a showcase of the community that we hope you will be a part of in the coming year. The campus is one of the most striking, I would say, in the East Coast. Large but inviting, lots of green space. Our particular school is tucked up in a corner of the campus and has similarly unique architecture, lots of open spaces, lots of light, lots of areas for students to study. A unique element of our school is a very large undergraduate population. We have over 2,000 undergraduate students in 4 different majors. And so many of our graduate programs have linkages with our undergraduate programs, which provide unique mentoring opportunities for our graduate students as well. And many of these things you already are aware of because you applied to the university and our school and now have been accepted. And our goal today is to help showcase those elements that we think are unique, much as Dean Lushniak outlined. We have a remarkably diverse student body. We are accredited by the Council on Education for Public Health across all of our degree programs. Also, as Boris mentioned, we are uniquely situated within the Baltimore DC nexus and within the DC Beltway itself. And that provides what we call the Maryland experience, the opportunity to engage with internships and research experiences that are unique to our school, unique to the world, because of our ability to engage within federal agencies within DC, military organizations in the area, urban and rural settings, as well as nonprofit settings. Washington, D.C. is the nonprofit capital of the world. So these provide very unique opportunities for our students. I am proud to say that our placement rate for our graduates from our graduate programs are remarkably high. 95% for our MPH and MHA grads in our past year, and 100% employment for our PhD grads. So for our master's program, 88% of them leave employed. Another 7% leave moving on to another degree program. These are very strong rates, and we're very proud of those rates. Our master's programs graduates, many of them go off into healthcare organizations. Probably not surprising given our area. Many go into the federal government or other nonprofit organizations as well. And then a number go on to state and local government health departments, as well as for-profits and academic institutions. Those graduation rates are actually pretty steady over the last several years. So we have strong placement rates from our graduate programs that extend almost for the past 5 years. Our doctoral program alumni, most of whom will head off into either academic institutions or the federal government. And we also see others moving into nonprofits, healthcare, and for-profit organizations. Again, congratulations on your acceptance to the University of Maryland School of Public Health. We hope that the Accepted Students Day has been a valuable and informative event for you. Ultimately, be sure to reach out to the graduate director of your program or to Britt Saxvig, our Director for Graduate Student Services, Lana Duarte, our Coordinator for Admissions and Recruitment, or myself, Steve Roth, Associate Dean for Academic Affairs. We look forward to seeing you this fall. Take care.